It's marvelous and heartbreaking to see how a child is getting happier and stronger in life. As years pass, day by day, self-confidence and feeling control of life increases, day by day, month by month, and year by year, as this small human model gets older.
Really no specific causes for developmental delay in children. All are not theories, merely hypotheses. Usually the families, especially the mothers, attach to these hypotheses and looking at it as theories. For that reason, it's very important for the psychiatrist and the psychologist and even the social worker dealing with the family or the educator to explain the family the real knowledge about these disorders.
The age should be before 18, and there is impairment in the adaptive functions of at least two important domains. This may include the communication, the self-care, the academic skills of the children. So impairment in at least two important domains in their lives, and the age should be, of course, before 18. The condition is classified to mild, moderate, severe, or profound form. In the mild way, there is a delay in speech, but eventually clients can use everyday speech. For example, there is minor organic abnormalities in the mild form of intellectual disabilities. And of course, if we go to the moderate, severe, or profound, we will find more impairment in speech, more impairment in acquiring the appropriate language skills, as well as there will be a more prevalent neurological impairment in the moderate, severe, and the profound form of mental retardation.
It's no way a state-of-the-art organ that controls the whole kingdom of the human body and soul. Every area in this forever updated hard disk is specialized in certain areas of our lives. For example, in the upper part of the brain, there are areas that control motoric skills, whether gross, like running, a child running and playing, or very fine, like tying your shoelace, a child tying his shoelace. Accordingly, every tiny part of this very advanced device is controlling every aspect of our life. Areas of motor control are different from sensory areas, where we can experience thermal changes, painful sensations, tasting, smelling, and other senses, in addition to emotional, reading, writing, worshipping, and romantic or aggressive feelings.
There is a lot of deterioration at thinking process, especially abstraction or abstract thinking, or the ability to orient about the content. And we can find also that the patient with intellectual disabilities suffering also with maladaptive social functions, such as deterioration in social communication skills. Most of the diagnostic criteria concerning intellectual disability is related to significant impairment during any of developmental phases. Intellectual disabilities has overall concerning population with 1% as a percentage. Most of the recent studies started to focus about the percentage of intellectual disabilities concerning children and adolescents. And we can also find that intellectual disabilities may reduce during the developmental phases, but at the overall studies started to say that the intellectual disabilities within 1%. Differential diagnosis. Intellectual disabilities, it's completely different between other intellectual or neurodevelopmental disorders, such as communication disorders, autism spectrum disorders, and attention deficit hyperactivity disorders and motor disorders.
But sometimes, unfortunately, the story is different. Brain insults during early pregnancy and even before cellular division of the original cell responsible for formation of the human creature is fully formed.
Sometimes the mothers and the fathers go and blame themselves. Why we marry earlier? Why we marry late? Or sometimes they question themselves why you get pregnant earlier or a little bit later. A lot of causes coming, colored with the personality of the mother or the personality of the father.
Regarding sex differences between boys and girls, it has been estimated that mental retardation or intellectual disabilities 1.5 times more common in male than female. Comorbidity. The comorbidity or the prevalence of comorbidity with other mental illnesses in addition to intellectual disabilities mainly depends on the severity of mental retardation or intellectual disabilities, meaning that there is a preliminary report or recent study found that there is around 40% of intellectually disabled kids meet criteria for another diagnosis of another mental illnesses. We have also severe mental retardation. As we said, the severity of mental retardation or intellectual disabilities came or comorbid with another mental illnesses. Particularly, if we have severe MR, there is a high association with autistic disorder.
They can be classified globally into 3 categories, according to the time when the insult has occurred. First, the causes related to conditions of the mother before birth of the child, medically known as prenatal stage, in addition to natal and postnatal stages.
Assessment of intellectual quotients, or IQ. We can use several sub-skills or several tests to make an evaluation of mental abilities and cognitive functions, such as Stanford Binet, for assess the non-verbal and verbal domain in children and adolescent and even adulthood and geriatric. The main target to assess the intellectual quotients to identify what the main degree of intellectual deterioration in neurodevelopmental and intellectual disabilities, which is profound mental retardation or mild mental retardation or severe mental retardation or moderate mental retardation. If you found that the patient between intelligence quotient less than 65 degree, so we have a clear degree of mental deterioration and intellectual deterioration, such as you will find a deterioration in his learning skills. You will find a clear deterioration and a significant impairment in his attention, concentration, short-term and long-term memory, and his perception, so that he cannot able to learn some sort of important skills to help him to continue in his life. Gender-related diagnostic issues. If you make a comparison between gender concerning neurodevelopmental disorders and specific in intellectual disabilities, you may find that the intellectual disabilities most common in males in comparison with female, and the pyramidology of intellectual disabilities in male, it's maybe 17% in comparison with females that may classifies within 9 to 12%, so that the percentage in males it's most powerful and most great in comparison with females.
To evaluate the degree of these negative brain insults, batteries of tests and inventories that cover every tiny component of the human performances has been applied to assess degree of backwardness in the affected area of functioning. Questioning the relatives, history taken to the parents, observing the degree of development in comparison to children from same age group, and interacting with the child are some methods to reach the proper diagnosis and to assess the degree of severity of insult. Therefore, tests for intelligence, personality, autistic features, abilities, scholastic achievement, and so on has been prepared.
Diagnostic criteria. What do we mean by diagnostic criteria, or how can we diagnose intellectual disabilities? We mainly depend on two components. First thing, IQ testing. Second thing, the level of adaptive functioning. What do we mean by IQ testing? Usually this is standardized test, and it is done by clinical psychologist who has practice in doing such testing. Meaning that if the child got score of less than 70 in the sub-average in intellectual functioning, in addition to that there is a limitation in adaptive functioning, meaning that the child cannot dress himself, cannot eat by himself, cannot take care of himself, cannot shower himself, and he cannot deal with the daily living functioning, like dealing with the money. So if the child has low IQ, less than 70, plus there is impairment in adaptive functioning, we can consider it as intellectual disabilities.
Sign and symptoms in intellectual disability. There is two patterns of intellectual disabilities, and you can make a very significant comparison between the sign and symptoms. Sign, it's the signals you can see in his clinical picture, the patient when he comes to the clinic for the first time for evaluation and to take the psychosocial history. You can find his behavior, inappropriate behavior, and you can find also that he has some sort of aggressive behavior during the session with you. Or you can find also that he cannot able to make an eye-to-eye contact with you. On the other hand, when you assess the symptoms of intellectual disabilities and intellectual deterioration, you can find a global developmental deterioration in his physical developmental phase. So he can be delayed in language, expressive and receptive, and also he can be delayed in his able to motor skills, specific the fine motor skills.
Different treatment plans are used to solve the neurodevelopmental disorders. For example, physiotherapy is commonly used to solve motor problems, medical or pharmaceutical preparations for some deficiencies in enzymes or neurotransmitters. Also, untraditional varieties of therapy are sought for, like music therapy, play and story therapy, in addition to this so well-known line of alternative medicine.
The society and the culture color the presentation of any psychiatric disorder. Even not only the psychiatric disorders, even the physical disorder colored by the presentation by the society and the culture. Some of the societies who believe in magic or ghosts or evil eye, they will explain all of the neurodevelopmental disorder by these issues. As modernize the country, they will minimize the explanation of these things. As the country or that society less modernized, they will magnify the picture of these disorders by looking through the spiritual issues. For that reason, no specific drug treatment for neurodevelopmental disorder. These drugs you are using in psychiatry mainly treating the symptomatology of the neurodevelopmental disorders. This should be very clear for the therapist, for the parents, and for the family in general. It is not clear that there will be some problems between the parents in dealing with the child, and why the family are jumping from one psychiatrist to another, looking to the neurologist, or going to non-physician looking for the management of their kids because they don't know or they don't understand the concept of the disorder they are dealing with.
The medication directed against comorbid, usually there is no cure for intellectual disabilities. There is no cure, but we are treating any associated or comorbid illness, mental illnesses. We are using medication sometimes to overcome if there is any hyperactivity, any aggression, any self-injurious behavior. In case of, for example, aggression, we can use some sort of antipsychotic. If we have any self-injurious behavior, also we can use either antipsychotic or mood stabilizer. If we have a kid who is mentally disabled or intellectually disabled kid with, for example, mood disorder or mood symptoms, we can use some sort of antidepressant.